Hello, so excited to be back with you guys today. This episode is going to bring two main things. One is good news with great joy, and two, I hope to use the story to infuse power and hope into women runners with hip pain around the world. So let's get into it. The good news with great joy for those of you that have been following me, maybe on Instagram or Facebook, you know that I signed up for my first race in literally forever. Life has just not lended itself to allow for training cycles, and also I was dealing with the hip injury for the past couple of years, and I feel confident enough to actually enter into training. So announcing it, I'm doing the Suncadia half trail race, and I am so excited. Second thing for today is I want to talk to you guys about how I healed my hip conservatively, how I got to back to running pain-free conservatively, meaning that I have used no invasive medical interventions. The furthest I've gone is physical therapy, and that is where it started, and that is where it ended. And I want to just preface today's story, or my story, with saying that this does not have to be your story. This is not medical advice. This is not how you have to go about your treatment, but I have found it so empowering, so hope instilling, hearing other women go through the same battle that I went through and have successful outcomes, conservatively or even not conservatively, but just have successful outcomes, and hear how they got there and what their trial was, and kind of just learning from some of their misfortunes to better off my own story. So let's get into it. Y'all know that in 2020, the world ended, and life as we knew it was not as we knew it. And during that time, I was running a lot. I was running comfortably 4 to 8 miles, probably 2 to 3 times a week, maybe even more. And I was also strength training. And when the gyms closed, when life shut down, I was not able to strength train anymore because I didn't have access to the gym. So I was running a ton, and I would say probably wasn't adequately loading with strength training for about 6 months until we actually invested into a home gym at my house. And during that time, my bod felt awful. My knees hurt. I was achy, creaky. I just wasn't getting that stimulus from strength training, and it was not fun. Flash forward to about spring of 2021. I will never forget this. I was running at the Arboretum in Seattle here, and I finished my run, and the front of my right hip hurt. And I was like, oh my gosh, what is this? I am going to choose to ignore this and pretend that it's not going to come back. Now, subsequently in my life, I will say that I had a lot of girlfriends at this time that were experiencing hip pain. I had a girl that just had bilateral hip surgery for FAI. I had another friend that had to get a labral surgery because her hip was bothering her, so that was floating in my mind. I had a ton of patients at the time that had labral repairs and all this stuff, so my mind went into the gutter quickly. And I, as a gleaming physical therapist, chose to ignore it. So I said, it's fine, no big deal, we'll just keep running, maybe run a little bit less, swept it under the rug. And as you know how things go, my hip pain started to get worse. Worse to the point that I was running about 4 miles and my pain would last for a couple of days after. And I remember my pain being so severe one day that I went to work, which I used to work in outpatient physical therapy, just private practice. And I asked my coworkers to look at my hip because it was really painful. And they said, okay, things look okay. We don't think that you're glaringly positive for a labral tear at this point. There's nothing that's so severe that you really need intense medical intervention at this point. I think you should just go to physical therapy. So I set myself up with a physical therapist at my office. She is the absolute best. I recommend her to absolutely anyone and everyone. This whole story is not about her. She is amazing. And I started with her, and I remember going to my first session, and she did a full eval on me and kind of said, "Hey, Sarah, like, I think it's like your low back that's driving some of this. I'm noticing like hypermobility in through there. There's still hip components to this. Like, yeah, you have a little bit of anterior medial or just, kind of joint grinding at this spot, but I really think it's being wound up by your back." So went through that initial eval, and I remember like shortly after this period, my hip had a huge flare up. I think I ran and it lasted a lot longer. I started having pain with sitting, sleeping, like driving, oh my gosh, and then working as well. Like I was lifting bodies and just doing things as a physical therapist, and it was so painful. So I will never forget this day. I went on my computer in my like spew of anxiety and fear, and again, these women in my life going for another surgery, another patient with a labral repair, and my mind just started really spewing and saying, oh my gosh, what if I'm just wasting my time doing these conservative efforts and I'm just going to need surgery anyways? Why don't I just start that train and just start getting on the surgical train? And I reached out truly to one of the best doctors that I know in this area. He is just chef's kiss amazing. I send all my complicated patients to him. He is phenomenal. And I said, hey, I think I have something going on with my hip. Can we order an MRI? Like, I just want to nip this in the bud. And I spiraled, like, for a couple days. Like, I just remember telling people, like, oh my gosh, like, I think this is it for me. Like, I'm going to have to get surgery. I remember my wedding was about, like, probably 9 months away. And I was like, I'm not going to be able to, walk down the aisle. Like, I was just so stressed in that phase of my life. I was going through my orthopedic fellowship at the time. There was a huge stress component in my life that was like adding on to this. And I remember talking to my fiance at the time and just saying, who is also a physical therapist, and just kind of like sharing with him what I did, and again, like resharing, because obviously he knew what was going on. And I remember that he kind of encouraged me to like think about what I do for my patients and what I tell my patients, and to know that I tell my patients, like, there is power in healing conservatively. There is power in like taking the steps to heal, to walk with tissue guidelines, tissue healing guidelines, to kind of get to that phase, to release any like aggravating factors, to put in all pain easing factors, activities that make you feel good, and then walking along that course before you enter into the surgical options and imaging options and all that stuff. And it took me a couple days to really just like calm myself down. But in my calming state, as I got there, I recognized that, like, yeah, he was right. Like, I really wanted to do this conservatively. There was no red flags in my care at this point that said, you have a bone stress injury, you have like potential cancer, you have avascular necrosis, you have like a femoral neck fracture, anything like that. There was nothing in my case that was pointing to these red flag symptoms that maybe would elicit a higher level of medical care, and therefore I didn't need to be getting imaging at this point. It was just me, my stress, my control, trying to control the situation and say, hey, I really need extra care at this point. So that was hurdle number one, me trusting the process, understanding that I am not the most important person in the world. I am not the only person that has gone through this. I can heal conservatively if the flags are kind of pointing, or if the arrows are pointing in that direction. So at this point, I'm in for physical therapy. I'm in for conservative care. I'm like, let's go, let's do this. Roadblock number 2 comes up. So at this time, again, I chose to go to a PT in my office. Phenomenal. 2 problems. So, one, there was only one spot on her schedule that I was able to actually get into for the whole week. It's the only time I could make it. She could see me, so on and so forth. Number 2, at the time, I was with an insurance that you could have 6 visits of physical therapy, and then the insurance needed to say that you were still eligible for physical therapy, that you still needed physical therapy at this point. So I knew that my goal was really high level. I wanted to get back to running that 4 to 8 miles multiple times a week, and that was largely my pain driver. So running was largely my pain driver. It really wasn't anything else, and that goal, unfortunately, is hard to get authorized for physical therapy. So once I've gotten to those 6 visits, and if I need to get more visits approved, if I'm feeling really, really good, and it's really only the difference between running 20 miles a week and 25 miles a week that sets me off, I'm probably largely not going to get approved for those visits because my goal is too high level. It's not me driving. It's not me working. It's not community activities. It's high-level recreation activities, which I see time and time again get refused or denied more physical therapy coverage because it's too high level of a goal. That's just anecdotally what I've seen as a physical therapist who has battled on the phone with lots of insurance companies to try to get more visits for my patients who want to get back to what they want to get back to. So I'm trying to stay in the 6 visit allowance and not trying to go super high. So this really kind of sets me up for failure because I'm like, I don't want to come every week because I want to save my visits. I want to conserve my visits. Also, I don't have a goal on my sheet that's actually, like on my documentation, that's actually my goal. My goal was to get back to running 4 to 8 miles 3 to 4 times a week, 2 to 4 times a week, whatever it was. And the goals that we actually had to write were doesn't have pain while working, doesn't have pain while driving, can get back to running, but it just wasn't the thing that really lit me up and excited me to press onward. So I went through this kind of yo-yo of PT. I went to physical therapy. She gave me my exercises. I would do them consistently. I would get a little bit better. I would go for a run. I would feel good. I would go for a longer run. My hip would hurt. And then I was able to get it to my next visit. And then we'd have to backtrack a little bit. So I would do my exercises. Maybe some of them were bumped up a little bit. I would go for a run. I would go for a longer run. And then my hip hurt. And I just kind of kept going through this cycle. And I really wasn't able to consistently build a comfortable base for me to be able to run let's say even 3 to 4 miles a couple times a week. I was able to run, but maybe once a week. And if I ran more than that, my hip was just too flared up to do anything. So I wasn't consistently progressing towards my actual goal. And every time I actually ended up in physical therapy for scheduling reasons or because I felt like I needed it, it was because I was in a flare up. It was never like, hey, everything's feeling good. How should we progress this week? So found myself probably 5 months into physical therapy, knowing what was going on, having a list of exercises to do, but I really wasn't making progress towards my goal. And I'll tell you, at this point, I'd probably done, I think at the end of my PT, I think I had done around 8 sessions, and because we had gotten approved for 2 more. And I owed at each PT appointment, my insurance paid for it, but I owed probably about $100 to $125, somewhere in that ballpark, each visit. So at this point, I had already paid $800, and I really wasn't much closer to my goal, which was very frustrating. So at this point, I said, I am done with this. I want to get better. I need a solid end goal, and I know what to do. I just need to be held accountable to it. I need to be guided a little bit more, and let's freaking do this. So I remember, at this point, I was just angry. At this point, I had gotten married, so all the stress of the wedding and all that stuff, school was over, my fellowship was over, so at this point, I just wanted to be able to run again, and I had no barriers in my life to stop me from showing up to PT, blah, blah, blah. So at this point, I said to my husband, who is a physical therapist and is an amazing physical therapist, you're going to treat me. I said, you are going to do my eval. You're going to tell me everything that's wrong with me. We compare exercises to match my deficits. And then I just need you to help me to progress them, maybe just check my work. and help me progress them every, couple of weeks. And then I'm actually also going to add a running piece on here. So every time I exercise or whatever, I'm going to run like 2 miles and I'm going to build my base pace up. I'm actually going to include running into this program because that's what was tripping me up before. I was running and then running more and then getting hurt or having a flare up of my symptoms. So thus the hip return to run program was born. This is what I do with my clients right now. I quite literally, I look at them, I figure out what their deficits are, I give exercises specific to those deficits. We see what your training, run training is doing to your body and doing to your symptoms, what you can manage, and then we progress your exercises, and then we progress your running volume, speed, just your running portion to meet your goals and meet your tissue tolerance. And guys, I got better. I quite literally got better. I was able to run 4 to 6 miles twice a week. That's what my time allowed for at the time, for multiple weeks. And now at this point, I'm not as consistent as I used to be because I really just don't need to be anymore. I am able to run, do a couple things to maintain the progress that I made, and then I know how to safely progress my running back up to really whatever goal that is. So if I want to run a half marathon, if I want to run a full marathon, if I want to run an ultra, I know what I need to do exercise-wise, and then run-wise to safely get there. If I had to tie this podcast in a bow, these are the 3 things that I would tell you. Number 1, if you are experiencing pain in your hip, low back, knee, whatever, I don't care, and it's non-traumatic, meaning that it's kind of just come up over time, it's not from an aggressive fall, so on and so forth, get it checked out by a quality physical therapist. I am not lying when I tell you, after I do my assessment on my clients, if I have time to do a thorough assessment, I write in my assessment piece, okay, signs and symptoms are consistent with blank, and if that same patient goes and gets an MRI, goes and gets an x-ray, 9 times out of 10, I will tell you that their MRI findings are exactly what is in my assessment. We have the capability to look at your body, to listen to what you're saying, and figure out what's going on. We also have the capability to listen for red flag signs and symptoms, or just say, hey, this is not getting better. I'm going to refer you out. You need to go to your doctor. And also, here's a really good doctor that you should go to that actually they're going to get you in sooner because I'm sending you. So get a good physical therapist on your team. Number 2, I say this humbly, y'all. Don't believe that you are the only person that's going through this. I thought that. I was like, oh my gosh, I'm just going to skip the line. I'm just going to get an MRI and just get my hip looked at. I'm going to, just ask this doctor to do this. And really, I was still in the clear. There was so many signs and symptoms that I was actually going to heal well with conservative therapy. No one was telling me to get imaging at the time. It was just what I wanted, and I just wanted to take control. So believe that your body, actually know that your body has the capability to heal itself, that it wants to heal itself. That's its design in nature. And also when paired with the appropriate stimulus of exercise and movement and down regulation of fear, you can get better conservatively. The last thing that I would say is, if you've done the previous 2 steps and your physical therapist says, no red flags, I think you can heal super well conservatively, you don't need extra medical intervention, guys, find a physical therapist that is going to just get you hyped. They are going to give you an end goal, or you guys are going to work together to find an end goal that you are so excited about. Running a half marathon, running a full marathon, running a 50K, whatever it is, your why needs to be so much bigger than your current frustration, because there's going to be times where you're too busy to do your exercises, where you're too tired to do your exercises, where you're sad because you have to miss out on that 10K, but you need to be so excited looking at the horizon that you're going to pony up and you're going to do your exercises even when you're tired. You're going to say, hey, this half marathon in 2 months is going to be so much better than the one that I had to miss this past weekend. So those are my 3 things for you guys. I hope my story today was just helpful, just to see the way that someone else walked through pain from start to finish and got there with literally no extreme medical intervention, just believing that my body is set to heal, that I can do good things for it, and get back to running pain free. If you guys have any questions on my story or questions of what it's like to work through my Hip Return to Run program for me, feel free to comment on this, find me on Instagram. I would love to connect with you guys, and I hope to hear from you guys soon.